Dear friends, I am Dr. R B Phatak, consultant diabetologist, and on the occasion of this World Diabetes Day, I would like to share my thoughts on overweight diabetes with cardiovascular risk. An overweight diabetic person or an individual is already at the risk of developing cardiac events because overweight diabetic individual is associated with abnormal cholesterol and triglyceride levels, arterial hypertension, abnormal blood glucose levels, and central adiposity, meaning more fat over the abdomen. All these things, in addition to sedentary lifestyle and smoking or alcohol intake, can increase the risk for cardiovascular events. After this, we have understood the reason for this common risk factors for diabetes and heart disease. We would like to investigate the patient. The investigation should not only be for diabetes, but they should also include the investigation for the cardiac status by doing a ECG, 2D echo, and any other test as desired by the cardiologist. Only blood glucose is not enough. We have to do renal functions, liver functions, chest X-ray, in addition to your routine investigations. After investigations, we come to management, and that includes education of the patient regarding the disease, then dietary modification with the help of a nutrition specialist, wherein you restrict the intake of fats, take a moderate intake of proteins, and try to have more of complex carbohydrates with a restriction of refined carbohydrates. Then exercise, walking for about 30 to 45 minutes per day for about 4 to 5 days in a week is more than enough as an exercise if you cannot do a gymnasium exercises. Then if that is not enough and the sugars remain high, you have to use oral anti-diabetic agents, keeping in mind not to use the agents which help to increase the weight of the patient, but you can select agents which do not increase the weight, like metformin, DPP-4 inhibitors, SGLT2 inhibitors, or alpha glucosidase inhibitors for controlling the blood glucose. And your target for controlling blood glucose would be HbA1c less than 7, fasting blood glucose somewhere around 100 to 120, and postprandial blood glucose anything between 140 to 160 or maximum 180. So if you can achieve this particular targets, then your treatment is successful, and for that you have to discuss these issues with your physician as well as the nutrition expert. Thank you.